the healthcare system structured here?
There's this big inequity of health provision in South Africa. If you have money to afford a medical aid, which is like health insurance, or if you work for an employer that can provide you that, then you can go see the private doctors and pay substantially more, but also get deductions through the medical aid scheme. But if you don't have either of those, then you can go to any government health facility and receive free care or very minimal charges for certain procedures. But there's real inequity of that distribution and what's provided, because the government health sector has very few money and resources to hire doctors, to retain doctors, to hire clinical associates, to hire nurses, to hire and staff it, and to have the resources available. You're running out of medicines quite often.
Quite often.
Of sterile packs, quite often. You're not able to run your theaters. Whereas then this side gets all of that resources, but only 20% of the population. And so now, in the last 6 years, there's been a movement to try to equalize this with the National Health Insurance Scheme, the NHI. And so is that all South Africans will be provided with health coverage, and they can go to the private sector or the public sector. And the idea was to bring up the public sector so it meets the same provisions as the private. And so they're going to have to redistribute these resources, as you're talking about, and pull money away from private to start putting more into public. And they're going to have private doctors starting to work more in public, and public facilities accepting private facilities accepting what was public patients at that time. So there's a real move to try to mix this. It's going to be a challenge, but they're working towards it. NHI is now a nationally embraced scheme and has phases to go forward, offering kind of general 16 services of healthcare needs, from pediatrics to maternity to surgical to et cetera, et cetera. But opportunity for us as clinical associates is that we can get in on this National Health Insurance Scheme, and our clinical associates can be employed at either place because they'll be flexible enough to be here or here.
An interesting fact, Scott, I think we talked about this not so long ago, where of those 16 goals with the NHI,
that's right,
clinical associates satisfied 10 of them, or meet 10 of those.
Yeah.
16 is it goals or services? Yes, services by the NHI. So it's...
That's right. I think there's opportunity if we can help, like you were saying, or I said earlier, that the clinical associates are flexible enough to move in and trying to find where those gaps are. They can move into this NHI scheme and get more and more employment opportunities that way. It'd be really advantageous of it. And it would continue to serve that overall mission of clinical associate, to serve the population of South Africa, to serve those that are in need of healthcare.
Definitely.
Yeah.